Hey, good morning. It's 11 o'clock and we're just getting started here. We've got 26 folks on, so we're going to give it a few more minutes, let folks join. I know we have a DDS meeting that is just concluding right now, and also a managers meeting at Alta that should be concluding right about now as well. Hey, good morning, Olivia. Do we have a upcoming vendor forum to announce? Or Shirley, do you know if we have any upcoming vendor forums? No? Okay. I had a good time watching the YouTube videos of these old meetings because I had heard that not all of them had been posted. So I went in there and to go check them out. And um, so many of the screens are like, oh, there's four people on there and a bunch of empty boxes. So I wonder if I need to go back to for the recordings of this only showing the participants that have their camera on because it makes it kind of tough otherwise. But we're going to get started here, folks, because it is 11:03, and many of you are logging in coming from other meetings that we're just on right now. My name is John Decker. I'm the Director of Community Services here at Alta California Regional Center, and introduce Olivia, who is one of our community services managers, and Shirley, one of our specialists. And I'm sure we'll have a few more of our staff joining here as we get a few more minutes into this. But as I mentioned just a few minutes ago, before we got the recording going, was that we're just finishing up the DDS transportation rate study meeting, and I think everyone has acknowledged that the rate study in relation to transportation is going to be extremely challenging. And so I'm glad that they took the time to walk through it. And my understanding was is that there were still questions going on when I had to log off to get this one started. So again, we always want to encourage our service providers to participate in those meetings when they become available because, we'd love you to hear it directly from the people that are implementing these changes as opposed to and designing these changes, as opposed to us who are kind of just carrying out the recommendations. And so again, we'll talk a little bit more about the rate study in a bit, but again, that's where some folks are coming from right now as that meeting ends. I wanted to talk just briefly about the EVV presentation last week. Folks' thoughts on that. We'll go over what's coming up fresh with DDS. I'll talk briefly about something that went on with the YOLO Aging Commission about housing. We'll talk a little bit about PPE. We'll talk about test kit distribution, so COVID rapid test kit distribution. And we will talk about the COVID test kits themselves that have been distributed. We're going to talk about the upcoming, we're going to talk about upcoming DDS meetings, but the employment work group is one that I will specifically bring up to talk about. And then, as I mentioned, we'll give a little update on the rate study, and then wanted to talk a little bit, if we have time, well, we'll certainly talk about the extension of the booster mandate, but wanted to talk a little bit about social recreation as well, if we have time. So that's a bunch of stuff for us to go over. So what I wanted to share is that from my review over the last few days, it appears that our COVID numbers throughout our 10 county catchment area have in essence kind of leveled off and begun dropping just slightly as well, which is basically the pattern that has existed throughout COVID-19, is that we go through these surges and we have a bunch of new infections. The challenge this time around, and unfortunately I can't share the graphic that is created by DDS that shows just the increase of special incident reports that are related to COVID-19. But again, and I've said this previously, when it comes to the amount that we're receiving over double what we had when last January. And so, with that, last January we were in a really, really tough spot, and so we are well above double the amount of new infections. The hospitalizations are not close to the numbers that they were last January. It appears that though we have so many folks that are getting COVID-19, we are not seeing as bad of reactions to it. We do have one of the highest rates of vaccinated clients in the state for our regional center, and I think that certainly contributes to the health outcomes for a lot of folks. But with that being said, we're still reporting to DDS things like 42 cases, 44 cases, 20 plus cases a day. And so that's just so much higher. In December, we reported 31 total cases for the entire month. And so for it to switch so much in the month of January, and now we're kind of starting off in February with it as well. I will also say hi to Denise Hopkins as well, our family home agency specialist, who is in the middle of a family home agency audit, or hopefully towards the end of an audit sometime in the near future. And Marty has joined us as well, probably fresh from that DDS meeting talking about the rates for all of her transportation vendors. So thank you guys. So again, I think there's some room for some cautious optimism over the next few weeks that we might continue to see the rates go back down. My hope is that I can stop getting emails from Shirley letting me know about new day program returns to remote services. I certainly know that that's a big challenge. I know it's certainly challenging for our transportation providers as well, because get things all set up and then to find out that they're not going to be able to follow through with the routes that need to get there. But that being said, hey, it's been tough all around. We've seen so many new cases, and even within our own office at the regional center, and certainly we've seen so many DSPs that have tested positive. So again, just really high numbers. In talking about day programs, one thing I will share is that I've got this kind of communication back and forth with Sacramento County Public Health related to these rapid tests. And I think it was last week or so, I was able to go out to Mather and pick up a bunch that UCP delivered for folks. And while I was doing that, there's a day program, Central Valley Training Center's day program is over there, like right next to Mather, like right outside of there. And so I came in there and kind of snuck into the day program to go check out what was going on through the side door. That obviously I'm very familiar with it, but no one there really knows me anymore. So that was it was great though. I just to see all the staff there engaged with the clients, to see everyone following their COVID protocols with their masks on. There was like one client that was they have an employment program that's in another suite as well. And I went over to that suite, and to be able to see like all the clients engaged, and there was staff there. And then I saw the staff in one room working on the remote services with the client, so I could see them on video with the client at the same time. So it's very rare, and I know I have not done it in a long time, just doing like an unannounced pop-in visit to go see like a day program or a care home or something like that. But man, when you get like when you get an outcome like that and you see that like they're doing everything that we're hoping that you guys you providers are trying to do right now in the midst of like the second year, third year we're going into of the pandemic. So I don't know, just again, kudos to you service providers that are figuring out ways to continue to do this like week in and week out, whether you're doing the remote services, whether you're in person, whether you're back and forth. It's very nice for me to see. And the reason why I don't do an announce, but the reason why I pop by is because I figured since I was in the neighborhood, I would drop off some COVID test kits that I had just got from May 3rd to the program there. So anyways, like I said, I just, kudos to you service providers that are still doing this every single day, this long into the pandemic. I got some feedback from folks about the EVV presentation, and so I'm hoping that that was something that folks liked, having DDS come and talk with you guys. And with that being said, if nowadays it's so easy for us to be able to communicate and get DDS to meetings and things like that with you all. And this meeting, as I've said, is usually there's about double the folks that attend this meeting that typically attend our provider advisory committee. So one question I want to have is, in the chat maybe, and I know it took our whole session last time to discuss it, but would you guys like to see DDS come back to do more like question and answer type stuff with you all, or help like present on a topic? So in the chat, if you want to just let me know if that's something that you guys would be interested in doing, because I don't want to go down that road of bringing in folks and it's not really stuff that is interesting for folks. So I'm hoping if that is something that you are interested in, yes, please put it in the chat. And then also, as we learned during last week's, you guys send your feedback to these kind of anonymous email boxes over at DDS, but you guys got to spend an hour with the person that answers all those questions that go to the anonymous email box. And so so that being said, I would love to promote more of these types of things, but I just want to make sure that it's something that you all feel would be valuable to you in the future. So just let me know if that's something that you might want to discuss. All right, I don't have Jordan here right now, but I will talk about the PPE pickup. So Alta has been able to secure, I think it's a pallet of N95 masks and a pallet of surgical masks that we need to pick up next week in Sonoma. And so we're going to be kind of turning our PPE inbox back on. Like right now, if you send it in, it says, if you're a licensed care home, please reach out to community care licensing, or a day program, reach out to community care licensing for PPE needs. And otherwise, we don't have a supply. So that being said, we are working on building up a little bit of a supply for that as well. So we will certainly, when that goes live, which I'm hoping is by like next Friday. Some of you are aware it was extremely windy this last week, and I did not want to be the community services director that like crashes his truck with a whole pallet full of N95 masks on the causeway in Davis, because my pickup truck is like super lightweight and those pallets are just huge big wind sails on the causeway, and I did not feel like doing that. So that being said, we are going to get the stuff picked up and be able to start distributing it to folks. Hopefully by the end of next week. If not, it'll be the week after that. But the mask requirements and things like that are not going away, folks, on February 15th. I'm pretty sure you're familiar with that we're still going to have these PPE needs working with our clients in these, any type of congregate setting for probably quite some time. So we recognize that this might be a little bit of a kind of minor financial benefit for some folks because of the cost of these things as well. And so that's a little bit more of our incentive to get back into getting these out to you guys in the community. Because again, we know there's those increased costs. So that is going to be the plan for PPE pickup coming up pretty soon. Regarding EVV and DDS and things like that, I appreciate those that put their comments there on the side. And we will certainly look at future topics. I was talking to Aaron Christian, who some of you might be familiar with at DDS. Aaron used to be the director of client services and the director of community services at one time at San Gabe Pomona Regional Center. And so he and I were talking about him coming to this group and talking with you a little bit about a program that Alta is looking at participating in, which is the Columbus Staffing Program. So the Columbus Staffing Program seeks to set up a pool of available staff that can jump in the middle of staff challenges, primarily in residential settings. So supported living, um, uh, care homes, those types of supports. So that being said, there's a lot of detail that needs to go into it, and we're working we're working on getting it all presented to you so you can ask questions and things like that. But we figured we'll definitely talk about it during our provider advisory committee meeting, especially the one in March. But we will probably have DDS come during one of these meetings to be able to talk with you a little bit more about what the program's going to entail. I see Jim Kaiser, who has been so helpful with UCP in the chat there, indicating that they would be happy to help with PPE distribution if needed. So, that's one of the things that we've kind of been faced with, is a little bit of a challenge about, having enough managers on site. And I know poor Olivia got signed up with me to actually be doing it on Mondays. We're going to be the ones that are responsible for it. But man, with all the success that we had with getting these COVID-19 test kits out to folks from Sac County, maybe we can have a further discussion about a possible delivery of some of the PPE that we get on hand. Again, the thing that I hate is when it just sits in our office. Like if it's just sitting in our office, it's not really doing anyone any good, just like these test kits. That's why we want to get out as many as we possibly can. So, all righty, we will kind of revisit the PPE stuff next week, and I will connect with UCT again, specifically related to that. The next thing I wanted to share with folks is the program that is going on with California Department of Public Health, community care licensing, the regional centers, and a number of community-based organizations. And this is specifically to distribute COVID-19 rapid tests to licensees of care homes throughout the state. So what we are doing at Alta is that we are going to be holding 2 sessions. We're going to have we already have the test kits. These test kits are like the iHealth little orange ones that everyone's familiar with. That's what these test kits are. So these are the ones that these are the ones that we received from Community Care Licensing, California Department of Public Health, the big conglomerate that's working on this distribution. These test kits are to be used to assist in having visitors come into the home. So there's an understanding that there's a requirement to test individuals that are coming into those licensed care homes, and there is a scarcity of test kits. And so we can't just have visitation stop because of issues like that. So that is the idea behind this distribution. On Monday, I'll be standing out in front of our Woodland office, hopefully with some of our Woodland staff. I need to verify that, but I'll certainly be out there for a couple hours in the afternoon, and we'll be distributing to the Woodland, to all of Yolo County licensees. And again, not just Alta vendors, but all homes. So the other ARFs, the other residential, the RCFEs, those ones for the elderly, even the big assisted living centers are on our list. So they're going to be coming to our Alta office on Monday afternoon to get those. And then for Sutter and Yuba counties, Alta is assisting up at our Yuba City office. So I will be making an appearance in front of our Yuba City office on Tuesday morning from, I think, 10 to 12. And we'll be distributing to our Sutter and Yuba service providers. One thing is, at least at Alta, we know is that there's like 2 or 3 providers that have the majority of the homes up in that area. So it really makes it easy to pick up your COVID-19 test kits. But I don't know if we have anyone on the call or the meeting right now that are any licensees for those counties. But again, we've sent the emails out to folks, and we're going to make sure that everyone, gets their test kits on those days. With that being said, I was talking to Antonio Ranit yesterday, and some of you know Antonio. He's part of our provider advisory committee, runs some ICF DDNs with us, and there appears to be no concerted effort at a state level to assist our service providers and as it relates to getting these test kits for your own purposes. So I've been kind of looking around and talking to folks, and that does not seem to be in the works at all. I initially thought that that was what the plan was for these CCL ones, but it is directly tied to visitors that are going to be going to the homes. And that being said, each home is only receiving three test kits per resident. So that means that, if you have a 4-bed home, you're going to have what, 12 test kits that are going to be given to you. So six little two test boxes are going for each care home. So again, for those of you that actually run businesses, you recognize that, if you were using those to test your staff, that you burn through those in, a couple days. So with that being said, I know that we are still having test kits from Sacramento County. I'm going to look at doing another ask to see if they have any left next week as well. We're still pulling names off the survey that's been put out a couple different times. These test kits now, the date on them now is beyond. We're in February now, so these were ones that we provided you documentation that these could be used through January. Per Sacramento County Public Health, these are certainly ones that can continue to be used. What the recommendation is, well, first of all, my recommendation is don't store these and use the ones that we've given to you as quickly as possible. But each box that is given out of those test kits that folks received contained control fluid for the tests. And so the recommendation was once a month, pull a test out of the batch, test, check the control. I guess you'd have to use 2 out of the batch, but you can check the negative and the positive control fluids just to see if it's still registering at the top, and then whether or not it's showing like a positive at the bottom, if that makes sense. So I will tell you, I am not an expert in this. No joke, people messaged me wanting to like walk them through the steps of doing it, and that was just beyond my capabilities. But that being said, it is a relatively simple process, and they just recommended doing that once a month while you continue to use those ones. I have seen that they still appear to be accurate. I have used them because I'm the one distributing these things to you guys. And so it's important to me that when I'm running out to your cars or I'm in your facilities or wherever else, that I'm not bringing COVID with me in doing that stuff. So that's what's going on with the test kits, and we're still working on that. And again, looking at it, I think it's, one of those boxes of 20 is about $150 worth of test kits to be able to provide to folks. And so again, when I initially spoke to Alliance and to On My Own and to UCP and to STEP about this, my initial comment was, man, like, you got a bunch of providers that are also looking for a lot of financial relief right now. So you've got folks that can't find these things at all. And then you have folks that are dealing with the just increased expense of doing it. And that's why I'm just so thankful for our service providers that have volunteered and continuing to volunteer to help distribute these things to the kind of smaller service providers. So that's what's happening with test kits right now. I want to, let's see. Yes, you are very welcome. See, and Jen's a perfect example, right, of someone that attends this meeting to make sure that I follow through with the things that I say that I'm going to follow through with, because you have a captive audience. I'm here every Friday, so you can put things in the chat like, you didn't get back to me, John. When are you going to get back to me about this? And that's, we've said throughout this pandemic that we have to be really forward facing with you guys. We have to make ourselves as available as possible because things are changing at such a crazy, rapid pace that is completely unprecedented. We were talking about this, some of these newer community services specialists, some of the newer managers, they don't know what it was like before. Like poor Olivia doesn't know what it was like even at the regional center just a few years ago when, we had an annual trailer bill. Denise has been doing this, we won't say how many years, but Denise knows what I'm talking about, and Jean does too. We'd have a trailer bill that would come out. We might have 2 or 3 or maybe 4 different policy things from DDS that we might have to like look at implementing at a regional center level within the year. But that's like a month now with some of the things that are going on and the things that we're kind of have to keep track of. So it is certainly a challenge, but again, that's why we have these meetings, because we want to be available for you guys to be able to ask questions. And so exactly what's going on. Like as we learn it, we're able to provide it directly to you all. So With that being said, I'm going to start sharing my screen real quickly because I want to talk about some upcoming things with DDS, and I'm hoping some of you could help me with it really quickly too. So I want to go pretending like I'm sharing my screen, but I'm not. All right. Okay. And I got to be able to see you guys too. All right. Are we seeing DDS's website? Yep. All right. Perfect. So upcoming events here. Let me go to the calendar. All right. So upcoming events. One of the upcoming events, you know, we can start here, but actually, sorry, I was already on the next week. Down here at the bottom, there was recently, as we mentioned today, from 10 to 11, the rate model implementation focused discussion for transportation providers. Again, I know we had a bunch of staff that were there. My understanding was there was over 500 folks statewide. I'm guessing every regional center, just like us, is really concerned that we get this correct for our service providers, because there's so many different ways that service providers get paid. And so my understanding, I saw the little record button on, and so I don't know if you guys heard, because I had to log off, whether or not they were going to release the recording, but it seemed like they were. And so we will get back to this group. If you're a transportation provider and we find out that they posted this recording of this, we will email out that link to you as a transportation provider so that you have that.
Oh, John, this is Marty.
Yeah, go ahead.
I just wanted to mention too, I think they shared that the PowerPoint was also on in their website.
It is, yeah. And with that being said, let's go take a look at that. So here's the calendar, and it's showing up as already passed because it was this morning. And we'll go to rate model implementation, and let's see here. Let's see if we can find the information. Well, do this for me, Marty. Why don't you look for the information while I run over to the employment, because I know she put it in the chat, the direct link to the PowerPoint, but I don't know if I have it super handy. So, but real quickly, let me jump to another upcoming meeting that I wanted to talk about and get feedback from you folks for. So, not to skip over these other ones, there's an early start webinar that's going to be occurring. There's a Zoom oversight, accountability, and transparency work group meeting. So that's a DS task force meeting. And this is the work group from the DS task force for oversight, accountability, and transparency. And again, you click on this, and some of these, and this is what I was looking for Marty's, was whether or not it gives a direct link to that section within the DS task force. But the nice things about these ones are you can get information about the previous meetings, make a determination whether or not you feel like it's something that you want to participate in or not. So, and we have the regional center measures work group meeting as well. Recommend, again, folks that are interested in this, knowing how regional center measures, I know that it seems like some of that might be tied to our performance contract. We did receive the approval for Alta's 2022 performance contract, and I know that we spent a little time going over all of it with you, and I guess we can maybe look at doing a mid-year update to you all on the status of some of those activities, especially, you know, right now we're desperately seeking an employment specialist at our regional center because there's a lot going on in the world of employment, and we are short a specialist on that. And so definitely looking at that, and I wanted to touch on actually the employment work group, but I don't want to jump past the other ones that are coming up. So there is another electronic visit verification stakeholder meeting. I know that when Jennifer Parsons came last time to talk with us, she indicated that the recording from the January meeting was going to be available by like Wednesday of this week. I noticed that it is posted on their website, so that information is available, but this is the invitation to the upcoming one. And so again, these stakeholder meetings, I believe these are going to be the DDS hosted stakeholder meetings. And so again, that's coming up on the 22nd. The question that I had for folks is anyone in this group participating in, let's see, maybe I'll look. Oh, no, it's blank. Um, in the employment work group, is anyone from like a Alta service provider participating in the employment work group? Or does anyone know any service providers if it's not an Alta provider? Maybe I need to go to the chat. Or maybe just no one knows at all. All right. So with that being said, since it sounds like none of you are a part of that group, one of the things I would recommend is that you look at possibly attending this meeting, so that you have an idea of what's going on. If you're an employment service provider, I would encourage you to attend this. I know one of the things that it sounds like we might be talking about in this meeting is the employment grants and what the request for proposals for the employment grants from DDS are going to look like. So we'll certainly report back to you all. I will tell you I'm registered for this. I think I've shared with this group as well that I am the co-chair of the ARCA employment group. And so I'm quickly increasing my own competencies when it comes to employment services so that I can provide, better guidance for our regional center. And again, hoping that attendance at this employment work group is going to be something that is going to be helpful. So again, as I share always, I encourage you to take a look at the upcoming events at DDS. Get yourself possibly, signed up for them. I was in the employment specialist meeting gosh, I guess it was just yesterday. And there was all these questions about self-determination and what are billable things and what are not billable things. And one thing I encouraged folks to do, as I would also encourage all of you to do as service providers that are possibly looking at providing those self-determination services, is get on the self-determination mailing list for DDS. You can get on that mailing list for DDS, and you'll be able to get all those email updates. And I recommended the employment specialists do that, that work for the different regional centers, so that they're also aware as they're starting to hear questions about self-determination and how it's, working with, like, for example, the, paid internship programs and things like that. So again, just encouraging folks. I see it says Carol Watillo might be part of that group for employment as well. So good. Olivia, and oh, look at that. We have, there it is, DDS stakeholder events. That's the link where you can get signed up to participate in these things. Thank you very much. So I know we're still working on the rate study, right? We're on batch number what now? 3. And this says, and do we know how many total batches? Is that kind of like a trick that they played on us? Is they didn't tell us how many batches? Like there's not like 200. There's not 200 batches like there's 200 service codes, is there?
I thought I heard 4, and we have 3 and 4, but that maybe I made that number up in my
I
head.
think you must have made it up.
Okay.
Because I didn't.
I will tell you, I believe I have also heard that it was 4 at some point. And I kind of hope, because some of us were just in that meeting with DDS where they were talking about the transportation one. And my note that I wrote down was that they're hoping that the batches are complete by mid-February. So that would be them releasing batch 4 to us, which I don't know if they have already.
We have batch 4.
So that was the first time that I had heard that they wanted to try to get apparently all those back from regional centers by mid-February. But again, there's a reason why there was so many different staff that were in that. I mean, again, 500 plus people that were in the transportation one, because Alta does things so wildly different across vendorizations, but within transportation. But then all the regional centers also do that too, and you got 20 other regional centers. And so, anyways, I understand that this all boils down to figuring out what the one trip rate is for those transportation providers. But it is, it's certainly going to be a challenge, and we want to make sure that we get it correct. One thing that we did hear, in this, I think it's the first time I heard it in a public meeting, was that just because this doesn't get completed by April 1, it doesn't mean that you're not going to get your rate increase. It just means that we're likely going to be having to retroactively pay back your rate increase maybe for a month or two if there's just certain things that weren't figured out. And in some service providers cases, that might be beneficial, right? Like we don't want there to be any big, like anything that's inaccurate that is delivered to the state related to that stuff. And again, to the best of our ability, we're filling things out related to the ways that folks were vendored. As folks that have gone through an audit might know, your contract with the regional center, the vendor file that you have, the rate letters, things like that, are those good primary sources of documentation. And our specialists are looking back at those things. But just like I recognized when I was a specialist 11 years ago, there's some gaps missing in the history with a lot of these providers for when they first got vendored. And so that certainly does make it a challenge and makes it our responsibility to make sure that we're clearly communicating to our providers that, we're going to need help with this. Like, we don't have that answer. Let's make sure we're on the same page about it. And again, if there's disagreements or anything like that, let's take that opportunity. I know DDS has also previously discussed that there will be an opportunity to, question or appeal those things. As always, it will only be able to probably be fixed. It will likely require us to do a retro payment back, in essence. Questions about that? Do you think, Gene and Marty and stuff, that we need to hold a vendor forum like in the next very soon amount of time?
I think
with our transportation providers?
maybe because we're getting questions already, like when they talked about what's going to happen in
26.
2026, and we're already getting questions in my email from transportation providers. And I just want to encourage everybody, just hold on a minute. Let's get through these batches and let's see what we have as the outcome. Because we can't we can only do one step at a time.
Absolutely.
And so we're not going to be able to answer the questions that are going to come up in 2026 at this time.
Yes, that is correct. And so again, full implementation is, July 1 of 2025 with as what was just stated was that June 30th of 2026 would be the date, if there was a decrease to a rate that was going to occur,
Right.
that's when that would occur. Well, one thing that everyone was abundantly clear of is that you will not be paid any differently for the month of April than you were paid for the, month of March. You won't bill any differently. It's, it's not, the only thing is that hopefully the rates are in place. And so when you do that, April billing in the beginning of May, that your rate increase is already on there. If you're a service code that's going to get a rate increase, again, some service providers have rates that, are not, or excuse me, that are, well above what the rate study has indicated. So again, still working on that. I feel like either I think we need to do something with the transportation providers probably in the next couple of weeks though, just so that because we're still fresh from this DDS meeting where people learned about a lot of this stuff. And I think people have a lot of questions. So let's talk a little bit more about that this next week. And let's see if we can, I understand though, that we want to ensure that we, are on this, we've processed enough of these so that we've got a good handle on it as well as we answer questions for folks. So we'll certainly talk about that a little bit more. I meant to share that there was an extension to the booster shot mandate. So we knew that there was a booster shot mandate that was, had come in place, and it was a 1 month extension. Is that correct, folks? The booster shot mandate, yeah. So again, we had DDS here last time, and you guys had such good questions. I didn't want to take away time from that to go over, things like the booster shot mandate, and many of you are staying on top of that because, it many cases it means an increased cost and possibly increased retention challenges with staff. So I certainly know that you guys are following these things. And I want you guys to know that we recognize that. Like, we recognize that when you see things like this, that's what you're thinking about. That, what's going to be my increased cost and what is it going to cost me and my staffing as well for some of these things. And I will tell you, the regional center is right there as well. We're a nonprofit, and when these increased costs happen, it can certainly be a challenge. I want to see if, we can do this for maybe like about 5 minutes, and we'll see if anyone has any questions after that. I want to talk about social recreation real quick. And Gene and we've been talking about social rec a lot. I know we have a big meeting next week. And what I would like to get feedback from this group is, and maybe you could drop it in the chat if you want to, or you're welcome to unmute yourself, is if we looked at putting like a webinar out there, if we looked at putting information out there broadly to our community, trying to attract folks related to social recreation activities, what would you recommend that we include in that information, in that, like, what if we're going to do a webinar, what about the regional center, what about our clients, what do you guys think that we should include in there to help provide more opportunities for our clients? So does anyone have any thoughts about that? Well, I was just tell you, one thing that got brought up was, well, you can explain the vendorization process, you know, in a webinar to folks, so people are familiar with that. To me, I kind of expanded that as, well, I want to talk about not just vendorization, but how do you get paid? What does the billing look like? You know, if we're using what are called usual and customary rates, which, you know, it may be that someone already has like an aid that works for them at a certain rate, and we might be able to fund that aid for the specific work that they're doing to support an individual's needs related to their developmental disability in a social recreation program. So that's one thing I foresee putting in there. But I was wondering what you all had as far as any additional thoughts about things that we might want to put in there. And I will open this up to the Alta staff as well, because I know the specialists have not had this question posed to them. So again, thinking of outreach to our community, all kinds of different social recreation type of, you know, opportunities out there. So, you know, not only thinking about, you know, hippotherapy, the horseback riding, the swimming classes, the karate, but also, you know, those are, many of them are privately owned businesses and things, but also thinking about like outreach to rec and parks departments throughout our 10 counties and that type of stuff as well. So does anyone have any ideas about that? Things that we should include in a webinar if we're going to do outreach to those folks to try to get into business with us so we can provide more supports for our clients? Sometimes what happens is that you guys all start talking at once, and then the microphone just gets like blocked off completely. So do we have anyone that has any, well, I guess one question is, does anyone have any interest in us in increasing social recreation opportunities for our clients? Is that something that we can all be on board with, that is something that the regional center, you know, those services have been gone for like 12 years now, right? I think it's been 12, 13, 14 years. Gosh, it's been, yeah, quite some time. So it seems like maybe you guys don't have any feedback about what we should do as far as that outreach. I will say this, Gino Nessie, if you don't mind dropping your email address in the chat box real quickly, then if folks do have any ideas about what we might look at including, I think that was good. I think, you know, what Gene has been, I wouldn't say preaching, what Gene has been repeating over and over and over again related to this topic is inclusion, and making sure that inclusion is involved in these programs. And that's one of the reasons why I think we've been doing these weekly staffings with our best practices committee to talk about some of these requests, because we want to ensure that we really are, you know, offering opportunities for inclusion for our clients that are participating in these things. So for me, you know, I'm looking at financially, what does that look like? You know, if you want to get into business with the regional center, and what we're looking for is, you know, inclusive opportunities for clients. And I think for us, I think that would be important for us to describe that, especially in the realm of working with individuals with developmental disabilities. So again, if oh, look at that, I'm looking at the chat now and I'm seeing comments coming up. So one of them is, I think that due to the fact that COVID isn't just going to go away, we should look into social recreation activities that are COVID friendly, i.e. outdoor, open air. Yeah, absolutely. I think that, you know, that is fantastic. Just a basic overview. I don't know what can be done. Move to California just as they were closed down. And then how about art centers or studios that offer public classes for ceramic, etc.? Yeah, I mean, again, absolutely, right? Those are the types of outreach activities that we want to ensure that we're looking for. So again, I'm going to be leaning on Gene a little bit about this, because I'd like to be able to kind of get like maybe 3 or 4 topics that I can look at, you know, providing into a short I would love it if it was like, imagine us doing like a half an hour or like a RFP orientation or something like that, where we really talk about our needs, but then we're also really talking about with the needs, understanding our population and also how we fund, services. Um, City of Davis alternate recreation program might be interested in becoming vendor if Alta is actually going to pay for social recreation activities. Gino and Nessie, are we actually going to pay for social recreation activities? Thumbs up.
We're still sorting through everything. Yes, but yes, that appears to be the direction we're going.
It
Yes.
sure does. And I will tell you, I'm rereading every single staffing that we've had thus far to kind of take a look at our the way we're moving as a regional center when it comes to approving these things. I'm liking what I'm seeing. I will tell you, our commitment has been that we're not going to wait for a vendorization to happen to try to meet the immediate needs of our clients. And Tracy Brown has joined us, one of our associate client services directors. And Tracy's one of the voices that is most commonly heard in our best practices committee. She spends a lot of time providing support to our managers and our service coordinators when it comes to some of these complex questions like, how do we bring back a service that's been gone for 12 years, and when none of our staff have necessarily been even trained to conduct an assessment as to whether or not the service would be appropriate or how it fits in with all the other services that individuals might be having. And so I like our process though, because what seems to be the result for service coordinators is that the families are getting a response back that we will cover the cost for that, the immediate cost, and then we will through a reimbursement to the family, and then that we will also look at getting that vendorization going as quickly as possible for typically like a usual and customary rate. So
Yeah, and there's many community like parks and recs and that there is no cost to.
Yeah.
Well, we can figure out how to support families in getting their family member involved in those activities.
well, and again, and I know we've got Jean here who is got to be very involved in those different types of services along with her staff. And thank you guys for the comments on the side there as well, in the chat, to specifically talking about this stuff. So I'm gonna just slide back up to a little bit more here. So we have the City of Davis. And I will tell you, I grew up in Recreation Parks when I was a kid. It was like, it was like mid 80s. It was it was definitely something that, my parents would drop me off and I would do those things for like 2-3 weeks in the summertime and everything else. So I loved those programs growing up as a kid, and I would love to ensure that our clients have like the similar type of access that I had when I was a kid to be able to participate in those types of things. Um, One of our programs just took clients skiing at North Star. Lots of ski resorts support people with physical disabilities. So, that type of stuff as well is also, providing opportunities outdoors, away from the kind of monotony that some folks have fallen into with COVID. So again, to me, it's a great time to look at some of these different things. Let's provide state park passes so that our clients can access the different parks and lakes in the surrounding areas. Another great idea, looking at state park passes and being able to support folks. The discounted fishing licenses were always nice, right? But that being said, looking at state park passes and things like that, I think I might take a state park pass over a discounted Cal Expo ticket any day of the week. So let's see, can we find something like New Directions, or maybe we could reach out to those kind of programs to see if they would be funded. Do you mind sharing a little bit about that program, just so everyone knows what they do? Oh, it looks like you're muted. Oh, there you go. Uh-oh.
And here she's on mute.
No, sorry, your sound is not working. I apologize. Oh, now you muted and unmuted. Try now. Oh, I'm sorry, it's not working still.
What I know, John, this is
Yeah.
Jean. I don't know if anybody else knows. My understanding of New Direction is they plan trips for our folks to go on different kind of trips, some long-term, some short-term, but it's like a travel, I want to say travel agency, kind of.
What was that one that used to? Yeah, the Trips. There's a company called Trips too. I thought that does the Disneyland
Oh,
weather
maybe.
ones.
Maybe it's not New Direction.
Because
I
they
thought,
still, I think they still send me their little flyers. Cool. Yeah. That. Yeah. And again, for years we're like, regional center responsibility, but well, let's have more discussions about social rec and how we can get this as widely available to our clients as possible. Like, a year after year, there's been complaints about these services not coming back into place. And again, I like what Alta's doing because we're trying to take a really good look at all the different recommendations that are coming in to make sure that we've got, certainly appropriate services. And I know that Gene's staff are looking at working on updating vendorization specifically related to it. So,
John, can I share something about
yeah,
that
please.
too?
Absolutely.
That's Tracy. Hi everyone. Sorry I was late, had another meeting, but I wanted to let you all know also that for case management, with the other ADs, we just put together a PowerPoint regarding social rec. We're trying to do as much outreach as we can, but we start next week training our staff and looking at what that process is going to look like, what the policies and procedures are around it, as much as we can provide to them. And then I also wanted to, along with that, what you guys were just talking about and sharing ideas and brainstorming on different resources, whether they're generic resources or potential resources that we could look at vendorizing. I think we're also going to be doing that outreach to our service coordinators, because I know I was a service coordinator many moons ago when we did have social rec available. And so I've kind of tried to rack my brain and my memory around some of those services, going through old documents, trying to find some of those vendors that were utilized back then as well. So we're going to be reaching out to our staff as well to kind of see if there's things that they can recommend. So we are doing that outreach, and we do have PowerPoints that we'll hopefully have eventually be able to maybe present here, John, at the provider meeting too. So
Yeah, I think that would be awesome. I would love to be able to bring, like, because I've always felt like our providers need to know the training that our staff get. Like, they need to know the extent to which our staff are informed on these different things. And again, that's why I like these meetings, because you guys have the associate directors that are responsible for all of our case management staff that typically attend these meetings as well. And they can also hear the things from you guys and share things that are specifically going on. So with that being said, I will ask Olivia and Gene if they have any announcements at all coming up. No. Real quickly, we did put out the survey, and hopefully folks got it. And this is the strategic planning survey that was sent out via our MailChimp. We just encourage everyone to do that. I think that last I heard, we were doing a translation into ASL that was supposed to be done like today or something. Can you explain that a little bit, or what we're doing?
Well, I'm probably not the expert on it, but from my understanding, Rima Cornish, our deaf and hard of hearing coordinator, was able to take the survey and translate it into ASL, and then they were able to put it on YouTube. And they were also figuring out how to do it for individuals that may be deaf and blind as well.
So again, this is one of those policy positions that regional centers, were given by DDS that, who can argue against being able to make things more accessible to our community when it comes like surveys and things like that. So again, I, really, really appreciate the work that we're starting to kind of do to provide more outreach opportunities, get the message out there a little bit more widely. So and thank you, Olivia, for that update. And with that being said, we have all of 6 minutes left here that we're going to give back to everyone for their days today. So you guys have a great Friday. Look forward to talking to folks next week. There'll be a little bit more updates about PPE and stuff like that. And, again, everyone have a great weekend. Looks like beautiful weather. Take care. You're welcome, Michelle.